I call Alexander Donat from USA, non-surgical rhinoplasty, maximizing results, minimizing risk. Please.
Thank you very much for the kind introduction, and thank you again to Dr. Gold and the rest of the committee for the honor of speaking for you. I'd also like to say it was nice to be able to follow up my friend Dr. Suanchinda, who I'll likely be seeing in Bangkok a little bit later this year. Look forward to that. So injection rhinoplasty. I'm a facial plastic surgeon. I do a lot of rhinoplasty, but it's very fun to be able to achieve similar type of results in a very short period of time in the office with a little injection. Very gratifying procedure, but there's some key points that I wanted to try to convey about minimizing risk. By way of disclosures, I'm a trainer for Galderma and Allergan, but they've given no support for this conference. Just a little bit of history. Injectables have been used since the 1980s for the nose, as far as I could find. Collagen and silicone being the earliest, and largely have been replaced by calcium hydroxylapatite and hyaluronic acids currently. The ideal filler is, of course, safe and ideally durable. HAs, I think, do that well. We heard a talk earlier on calcium hydroxylapatite, which makes a strong case for that as well. One of the things I like about HAs is the reversibility. In experienced hands, anyone can get a little bit of ischemia if you're pushing it just a little too much, and so it's nice to have that reversibility, at least in my mind. There seems to be a trend toward increased safety with hyaluronic acid fillers. At least by one study published in the facial plastic literature a couple of years ago, but it's important to keep in mind that's HAs over calcium hydroxylapatite, but it's important to keep in mind that at least in the U.S. it's an off-label application. We have to disclose that to patients, or you could be considered to be performing battery on a patient. So contrast that the HA safety with fat. I do a lot of fat transfer, but I won't do it for the nose. It seems to have the highest rate of vascular complications, perhaps because of the larger particle size. Durability-wise, HAs seem to last a little bit longer in the nose frequently than in other areas, aside from perhaps the infraorbital region. And one study by Hedden showed in over 250 patients 1 to 5 year persistence of results with few complications and no serious complications. Broadly, the uses can include the dorsum, the tip, and the columella. It can be used as a standalone procedure or as a pre-surgical modality. What can be better than giving a patient a bit of a test drive with a result, being able to use that for a few, or look at that for a few weeks and months and see whether they want to do something more permanent or just keep doing that easily without the downtime, expense, and possible risk. Post-surgically as well, whether it's a minor irregularity that I've obtained or we've gotten from elsewhere, it's nice to be able to solve little subtle irregularities with a little bit of filler, either in substitution for revision surgery or as a temporizing measure until someone can have time to proceed with that. Basic nasal aesthetics. On front view, we just want it to be straight and narrow. Want it to have ideally a nice smooth brow aesthetic line, brow tip aesthetic line, a gentle curve from the brow to the tip. Although that said, I won't inject just beneath the brow for reasons I'll show, but overall straight and narrow in front view, and then on profile also straight, but maybe just a little bit elevated. So straightness from the radix or root of the nose up here, or nasofrontal angle, down through the rhinion, which is the bony prominence right before the cartilaginous dorsum or middle third, and then through the supratip area. The tip should ideally extend just a couple of millimeters at most beyond the supratip area or straight, but one key thing is not to have the tip ideally behind the dorsum, which could create a ptotic tip or perhaps a polybeak deformity type of appearance with fullness in the supratip area just before the tip. And then below the tip, which we want to be fairly defined, we want to have a nice subtle curvature, ideally from the tip down to the columella, which should otherwise be straight, and just barely visible beneath the nostril rims, just by a couple of millimeters. Otherwise, the columella might look retracted, as we say, or you can have what's considered alar hooding or covering of that columella. The ideal angle of rotation from the nose to the lip is about 90 to 95 degrees for men and about 95 to 105 for women, so just a little bit more elevated in women to create a more feminine appearance. If you over-elevate or over-rotate a male nose, it'll look more feminine. as we've seen in certain West Coast stars. Straightness and position of the columella are key. So that creates some opportunities for improvement of the appearance. In the dorsum, we can fill a deepened radix or root if that is out of balance with the rest of the dorsum. We can fill around a bump, so if there's a prominence at the rhinion, or the end of the bony part of the dorsum, then we can fill above and below that, as we'll see, in order to straighten that, so kind of raising the tide to cover the rocks. We can inject right at the midline to achieve a more narrowed appearance of the dorsum, which we'll see, by creating a narrower light reflex. The same can be true for the tip, which we'll also show, and you can achieve a little bit of projection, not a tremendous amount, and I'd be careful not to try to push it too much, particularly with that. But we can also get some rotation, at least the appearance of rotation, if we fill in the nasolabial angle. And conversely, you can get derotation appearance by filling in the infratip lobule area. Quick points on technique: needle injection, slow injection, low pressure, low volume aspirate pre-injection. Consider the lateral manual pressure to limit the chance of lateral spread into the ophthalmic distribution. Keep it deep and watch for blanching. A few quick results.
Thank you. Thank you.